my topic of discussion is cybernetic systems approach to the abnormality detection in the retina images using case-based.
Dr. Shushmita, can you just come to the dais?
Okay.
Tamojit, you can continue.
Just. Okay, case-based reasoning is an artificial intelligence technique that solves a new problem based on previous experiences or instances. And case-based reasoning systems, that is CBR, have gained a popularity in recent times in health sciences in aid to diagnosis, classify, and treatment planning. And CBR using content-based image retrieval, that is CBIR, has been used for the manage the digital images. Here, the computer-aided diagnostic system that using the medical images perform extraction of the relevant information and used to manage the digital images. Furthermore, due to the increase of the computing power, some emergent methods like random forest array classifier has been suggested by the work of Cunningham. So the common symptom, like the common cases in the NPDR that shows in the retina fundus images can be classified as bright lesion and dark lesion according to the color feature, and hemorrhages are formed when the blood vessels leak into the retina. In the advanced stages of the NPDR and also for the PDR, the microaneurysm and the hemorrhages are bright red and dark red in color respectively and considered as the dark lesion and cases. So drusen's are yellow in color and circular, and drusen is quite similar to hemorrhage of, and that is the present paper. Here I describe the description of the approach based on the image processing and RF classifier for the abnormality detection of the retina fundus images and compare with the common other classifier like SVM, support vector machine, K nearest neighbor, and navy-wire classification. So here is the proposed protocol. We have to first do DR database, we first given, then the lesion detection, feature selection, and formation of the feature vector set. Here the two types of set, one is training data set, another is test data set. According to that, there is a proposed classification of a new case occurs. So first is the lesion detection, and the lesion detection first the colored fundus images and contrast enhancement is applied for the input images. And after contrast enhancement, there's a Otsu multi-level segmentation is applied for the images. It is observed that many different shades of the color are present for the retinal images, dark red for the blood vessels tree and dark for the hemorrhages. And for this, before there is a optics disc elimination is the very elimination or removal is an important step for characteristics of any bright lesion. Next, the blood vessels tree is elimination. And after the elimination, there is a color. According to that, this is the decision tree for the feature selection: yellow, white, red, dark red, and black. And according to the area, there is cottonwool spot, safe, and normal. And it is according to the Euler theorem, it will be found that which type of lesion it is. So feature selection next, and for the elimination among the for the differentiation among the bright lesion classes, color feature is also useful as hemorrhage is generally bright yellow and cottonwool is slightly white is yellow. So this is the first the image, then the red free images, and afterwards there's the also segmentation done, and the blood vessels tree and the optic disc elimination done. So this is the categorical values for the low level feature for the different classes according to the color, sharpness, shape, and size. The hemorrhage, CWS, the microaneurysm, hemorrhage, and drusen are classified. Random forest classifier is an enabled classifier that is consists of a collection of the several decision trees, and it according to the time also. And but K nearest classifier, this is algorithm, it is the basis of similarity of the new case with the neighbors. Navy bias classification is on the theory of the conditional probability. So according to the results, we first calculate on the 20, there is a confusion matrix on Weka 29 machine learning classifier. The total value is calculated by accuracy, Matthew correlation coefficient. We found that there low level features like color, texture, and statistical feature for the classification. It is the 4 classifier we have used, but in terms of sensitivity, specificity, accuracy, it is found that random forest and SVM give the better result than KNN and NB. It is found that is according to the picture, there is RF classifier is 94.58 and 95.1 compared to the SVM, and it is much more greater than the NVR KNN. So conclusion, my paper is an attempt to develop a CBIR system for developing CBR approach to the detection of retina abnormalities caused by diabetic retinopathy and ARMD, and early detection of the disease can be suppress the progress of the lesion and minimize the loss of vision. Here retina fundus images are found and it is processed, images are taken, Otsu multi-level thresholding done, and 4 classifier we have calculated, and afterwards we found that RF classifier has 94.8% accuracy for the predicting bright lesion with ROC under area under curve. As this is the future work will also consist of including more images in the case database to provide greater accuracy, as well as images from the local hospitals to further upgrade the case database. And this is, thank you.
My question is that for a usual clinical person in a retina practice, can this be used with ease?
Yes, sir. Actually, we have to take the images, fundus images from the local, that is the case database, and we have to compare with the local person, the images, fundus images, and by comparison, we can calculate that which type of lesion it is, and how much chance of progression to the diabetic retinopathy or etc.
So it depends on the quality of the pictures.
Yes, sir. Actually, there is some, that is a totally the database. Basically, it's a standard database. First, 210 pictures are taken from the common pictures like the diabet or the eophtha and mesidor. These type of pictures are taken, and this is to be compared with the normal pictures.
So it's a normative compared with a normative.
Compare, and if the further progression of any chances of further progression of diabetic retinopathy or ARMD progression is to be calculated by this.
So how sensitive it is to detect an hard exudate and a drusen?
Actually, sir, according to totally calculated first by the color. So the first color taking that if the hard exudates, basically it is a that is a drusen is basically it is a yellow in color, and hard exudates basically it is a white is yellow. So according to this color is we have to calculate it according to the random forest classifier, and this classification basically gives the total direction that what it will be the lesion according to the Euler theorem, that is the Euler value. It calculates that what types of lesion it is and how it.
No, the practical application is, if I understand you correctly, the AI-based approach as a screening tool. So
Yes.
developing
Yes,
of a
sir.
software
Yes,
for,
sir.
as a screening tool.
Yes, yes.
Thank you.
Thank you, sir.
What all lesions are you,
Yes, sir.
what all diseases and lesions would you be?
At present, there is a diabetic retinopathy, and also the type, the lesion we have calculated, we have studied, that is the hard exudates, cottonwool spots, microaneurysm, and hemorrhages. Only these 4 types of lesions are calculated, and only for the diabetic retinopathy, NPDR, and also the PDR and the ARMD.
Nice work, thank you.
Thank you, sir.
Thank you, Tamojit.